We already made a video about the advantages of moving carriers. Hopefully you've already seen it. But in this video, we're going to talk about the issues when you do move a carrier. Now, to begin, moving carriers almost always comes because the company is trying to save the employees money and actually increase their benefits, or at least keep them the same. Usually, when you renew coverage, the prices increase, and sometimes moving carriers gives you that benefit of keeping the benefits you have or just lowering the prices of your renewal. But in this video, we're going to talk about some of the issues when you do move carriers. Moving carriers can sometimes mean, and it often happens, that you may lose your doctor. And one of the best things to do when you know you're moving carriers is to, first off, you can ask your HR, but if you actually go to the new carrier's website and go to the provider search, you can search to see if your doctor is in that new carrier and that new network that you're looking for. You could also call your doctor up and ask them. Again, we always recommend if you call your doctor, ask if they're contracted with this certain carrier on this certain network. You want to be very specific. So first, go to the carrier website, search provider, make sure they're under all the correct network and of course the correct carrier. Number two, you can call your doctor. And then number three, once you're a member, you can call member services and just triple check to make sure your doctor's in network. Again, when you move carriers, there's not always a guarantee you'll keep your doctor. And sometimes in carriers, there's no way you'll keep your doctor. But it's good to check just in case. Another disadvantage is the soft costs. Essentially, when you move carriers, it takes a lot of time to explain the carrier changes to the employees. You have to set up a lot of meetings. In comparison to when a renewal happens, most people already know what they already have. You may have to show the employees how to find new doctors, how the new networks work. Maybe there's different types of benefits or incentives with a new carrier. Essentially, there's a lot of time that HR has to take, and management in general, and all the employees to learn this new carrier. And that does cost money for the employer. So that's an issue, the soft costs. Another issue is that sometimes some carriers just aren't a fit for a certain company. Certain carriers have certain networks or certain plans that just fit a company better. Maybe it's your geolocation, maybe it's how your employees want to have their benefits handled, maybe they want more hand-holding, maybe they want less hand-holding. All those things actually matter a lot in regards to which carrier you use. I mean, some carriers have these huge PPO networks that you can use in all these areas, and some networks are just very, very small. So it really depends on what your company wants. Depending on what your company wants, moving carriers can drastically change the outcome of your benefits. So again, it's important to know when you move carriers to make sure you keep the main benefits, the key needs of your company in mind. Now, all of those are reasons why when you move carriers, there can be some disadvantages. And of course, there can be more than what we went over. But a lot of the times when you move carriers, again, it's for the advantage of keeping your benefits at a higher level, or of course, paying less. And usually when discussing these sort of things, the premium has the loudest voice in the room. But again, it's for the good of all people. When a group or an employer moves carriers, they're not trying to move carriers to make things more complicated. They're trying to move carriers to make sure that everyone can enjoy their benefits at a good cost and also at good benefits. Thank you for watching Better Benefits at Bittner. I'm Brett Bittner, your host, and have a fantastic day.